Okay, so I haven't got any slides. There we go. So, excuse me, I've not done this before, so. Like I said, I'm from Leukemia Care. We're a support charity based in Worcester in the UK. We are a national support charity, so we do cover all of the UK, including Northern Ireland. In 2016, we did a patient experience survey. We worked with Quality Health, which is a organisation who they developed the National Cancer Patient Experience Survey in the UK. So that's run by the government. But what we did, they only cover haematological cancers, but they don't break them down. And it's not specific to haematological cancers. It is just for all cancer types. So we developed a survey that was designed specifically for blood cancer patients. So it included questions that were more specifically, so about watch and wait were included, about living with cancer, rather than just living beyond it. So the whole point of the survey was to try and get evidence and data to show how bad the experiences were for patients or how good they were, but to get evidence, because you know the issues that cancer patients face, the blood cancer patients face, but we wanted to be able to get evidence to show how, to the extent of how bad these issues were. We ran it through from September to December last year, but there was a long time before that we were preparing the survey, and it was tested by blood cancer patients so that we could refine the questions and make sure they were appropriate. So there were two patient cohorts. There was the first cohort was just leukemia patients, because it was based on leukemia patients who had responded to the UK government National Cancer Patient Experience Survey. They don't break them down to MPNs, so we couldn't do it specifically for other blood cancer types. We could only do for leukemia patients. But to that, we had 1,320 responses with a 78% response rate, which was really, really high. It was better than expected. And then the second cohort was an online survey. So it went through different charities, including people in this room. So it was shared out with their patients in the UK. And to that one, we had 1,199 patients responses, 285 of who were MPN patients. The total was 2,519. About 500 of those weren't leukemia patients. So the first thing that we've done with the results from the report are producing a Living with Leukemia report. This was because, as I said, we had a large cohort of leukemia patients. So one of the main things we were able to do is compare the National Cancer Patient Experience cohort with the charity cohort and look at the differences between those responses and see why patients might have been reaching out to charities. The report made 10 recommendations around patient experience. So 1 and 2 were about early diagnosis, and that informed our campaign in September for Blood Cancer Awareness Month. 2 of the main things that we found in that one were that there was the lack of understanding of what leukemia is before diagnosis. And the second one was that both patients and GPs are not aware of the symptoms of blood cancer, or they're not being recognised as a cancer, which is leading to later diagnosis. And for leukemia, there's a massive problem with late diagnosis, especially in the UK. The other 3, so the third one was tailored information, which is about making sure patients are being given specific information for their blood cancer type, because the difference in experience between all patients varies quite significantly between the blood cancer types and the leukemia types. So that's about making sure they're receiving the information that's relevant to them. As I said, the other ones are all relating to different stages of the pathway. So it goes from before diagnosis through to understanding at diagnosis, treatment or being put on watch and wait, clinical trials, and then the emotional impact and living with or beyond their leukemia. So I haven't got time to go through all of the MPN findings, but these are a few of them that we had. So particularly before diagnosis, 40% of ET and PV patients saw their GP 5 or more times, and that was once they were experiencing symptoms, because there was a specific answer which patients could give if they didn't experience symptoms. But this was for patients who did experience symptoms but went to their doctor, which is obviously a huge issue, as we heard earlier. Particularly in MF, being able to recognise it early is really important. But the fact that doctors aren't picking up the symptoms when patients are experiencing them and just doing a simple blood test is a huge issue. 90% of patients did not suspect cancer. You can, with the vague symptoms, you can kind of expect that, but it's also about educating the general public to make sure they know that these symptoms, bruising or itching, that they could be signs of something worse, and making sure that they know to go to the GP and actually are enabled to say, can I have a blood test? So it's not, the whole point of the survey wasn't just to simply look at the problems that patients were experiencing, but what they were experiencing before their diagnosis, so we can catch the cancers earlier. Finding out what was wrong, I think it speaks for itself. Around 3 in 4 patients didn't have a full understanding of their blood cancer type once they were diagnosed, which means the information that healthcare professionals are giving their patients it's not laymanized enough, so it's not said in a way that patients understand what their diagnosis is. And that could be partly to do with the material that they're being given. There's quite a lack of leaflets or extra information being provided once they've been diagnosed. And actually that comes across as well in the emotional support, with over half of patients feeling more depressed or anxious since diagnosis, but half weren't given further information of where to get support. So there is just a lack of healthcare professionals giving their patients extra information about to get support and understanding of their diagnosis. So that's all I've got to say. We are doing another one this year. We're trying to get a bit of a wider perspective in the survey this year and send it out to a wider cohort of patients, but that's me. If you want the results, you can have them.
Thank you so much for that, Bethany. Is there any questions for Bethany? Here.
How many people responded to the survey?
MPN patients specifically, or on the whole, the wider?
Well, both, if you have the answer to both.
There was 2,519 patients that responded. These were based in the UK. 2,015 of them were leukemia patients because of the National Cancer Patient Experience cohort. There was 285 MPN patients. I have the numbers in front of me, actually. ET patients, there was 160, 34 MF patients, and 91 PV patients.
And can you look at the data by the sex of the respondents?
Yes. We have a full breakdown. I have a few copies with me of the results, but we are happy to send out the data to anybody who wants it. We're quite happy to do that so that people can look through it themselves and break it down how they like. We're able to break it down by different answers and things, so you can contact me to get the results.